Welcome back to Mirror Mind, where we peel back the layers of human behavior slowly, gently, and always with curiosity. Today, we're diving into a topic that's both fascinating and often misunderstood: diagnosing narcissistic personality disorder, or NPD. We hear the term narcissist tossed around a lot these days. It's become part of our everyday language, especially online. But when does narcissism cross the line from a personality trait into a full-blown clinical disorder? And who decides where that line is? In this episode, we'll explore how experts diagnose NPD, what criteria they use, why diagnosing this disorder is far more complex than most people realize, and how societal and cultural factors complicate the picture even further. So, sit back, take a deep breath, and let's begin. Part 1. Understanding the basics of NPD ***. Narcissistic personality disorder is part of the Cluster B category of personality disorders in the Diagnostic and Statistical Manual of Mental Disorders, commonly referred to as the DSM-5. Cluster B includes disorders marked by dramatic, emotional, or erratic behavior, like borderline personality disorder, antisocial personality disorder, and histrionic personality disorder. But here's something important: just because someone displays narcissistic behaviors does not mean they have NPD. Narcissism exists on a spectrum. On one end, there's healthy narcissism, the kind that allows you to have self-esteem, confidence, and boundaries. On the far end of the spectrum, however, lies narcissistic personality disorder, a deeply entrenched, rigid personality structure that affects almost every area of someone's life. According to the DSM-5, for someone to be diagnosed with NPD, their behavior must be pervasive and persistent *** across time and situations. Inflexible ***, meaning it's not just a reaction to a specific stressor. Distressing ***, either to the individual or to those around them. Impairing ***, meaning it interferes with daily functioning in work, relationships, or self-perception. In other words, the behavior isn't just annoying or rude. It's destructive either to the narcissist or the people in their life. Part 2. The DSM-5 criteria for narcissistic personality disorder ***. Let's look at the official criteria. To be diagnosed with NPD, a person must meet at least 5 of the following 9 characteristics. 1. A grandiose sense of self-importance. They exaggerate achievements and talents and expect to be recognized as superior without commensurate accomplishments. 2. Preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love. 3. Belief that they are special and unique and can only be understood by, or should associate with, other special or high-status people. 4. Requires excessive admiration, a near-constant need for validation and praise. 5. A sense of entitlement. They expect favorable treatment and automatic compliance with their expectations. 6. Interpersonally exploitative. They take advantage of others to achieve their own ends. 7. Lacks empathy. They struggle to recognize or identify with the feelings and needs of others. 8. Often envious of others or believes that others are envious of them. 9. Arrogant or haughty behaviors and attitudes, often presenting with condescension or disdain. But here's what most people miss: not everyone who meets 5 of these criteria presents the same way. There's enormous variability. Some narcissists are loud and flashy, what experts might call overt narcissists. Others are more subtle, withdrawn, and passive-aggressive, often referred to as covert narcissists. The common denominator? A distorted self-image, deep insecurity, and a profound lack of empathy. Part 3. The process of diagnosis ***. Diagnosing NPD isn't about ticking boxes in a 10-minute session. It requires in-depth clinical interviews, psychological history, and often multiple sessions to evaluate behavioral patterns over time. Psychologists and psychiatrists rely on tools like the Structured Clinical Interview for DSM-5 Personality Disorders (SCID-5-PD), the Personality Diagnostic Questionnaire (PDQ-4), clinical observations, reports from family members or partners with consent. It's also crucial that clinicians rule out other mental health conditions such as bipolar disorder, substance use disorders, or trauma-based responses which might mimic or overlap with narcissistic traits. And because people with NPD rarely seek therapy voluntarily, diagnosis often happens when someone presents with another issue: relationship breakdowns, depression, anxiety, or problems at work. The narcissistic patterns are discovered as therapy unfolds. Part 4, Common Misconceptions and Challenges ***. Let's pause to address some of the common myths and diagnostic pitfalls. 1. Everyone is a narcissist nowadays. This is a misconception fueled by pop psychology and social media. Selfies and self-promotion aren't the same as NPD. Narcissistic behaviors can be situational. Personality disorders are persistent and inflexible. 2. Narcissists are just confident people. Confidence is rooted in self-assurance. Narcissism, especially pathological narcissism, is often rooted in deep insecurity. The outward grandiosity is often a mask for inner shame or emptiness. 3. Only men have NPD. While statistically more men are diagnosed, women can absolutely have NPD. The presentation may differ. Women may display more covert or relational manipulation rather than overt dominance. 4. You can diagnose someone based on a few interactions. A proper diagnosis requires longitudinal patterns. It's about how someone behaves consistently over time, not one bad date or one argument. 5. Therapy doesn't work for narcissists. While it's challenging, therapy can help individuals with narcissistic traits, especially if they're motivated by a crisis or genuinely want to understand themselves. Progress is often slow but not impossible. Part 5, The Role of Culture and Society ***. Diagnosing NPD doesn't happen in a vacuum. It happens within a cultural context. What's considered narcissistic in one culture may not be in another. In highly individualistic societies, like the US, assertiveness and self-promotion are often celebrated. But this can blur the line between healthy ambition and pathological grandiosity. In collectivist cultures, traits like humility and group harmony are more valued. Narcissistic behavior might stand out more or be suppressed in public but acted out in private. Societal influences like capitalism and competition ***. Celebrity culture and fame obsession ***. Social media algorithms favoring boldness over humility ***. All contribute to an environment where narcissistic traits are not just normalized, they're rewarded. This doesn't mean society causes NPD, but it can enable or mask it. Part 6, What the Experts Really Say ***. When you ask clinical psychologists and personality researchers about diagnosing NPD, most will tell you this. It's one of the most difficult personality disorders to treat and to diagnose accurately. Why? Because the person often lacks insight ***. They may manipulate or deceive therapists ***. They often present as charming or high-functioning ***. Experts emphasize the need to look beyond surface-level traits. They assess the person's capacity for empathy, how they handle criticism and failure, the depth and quality of their interpersonal relationships. Their internal narrative, is it inflated, victimized, or fragile? More modern approaches also look at narcissism dimensionally rather than categorically. In other words, instead of labeling someone as narcissist or not, we ask, how much narcissism is present and how does it impact functioning? Part 7, The Impact of Misdiagnosis ***. Misdiagnosing NPD can be damaging both for the individual and those around them. Overdiagnosing ***, someone may pathologize normal behaviors or temporarily defensive strategies. Underdiagnosing ***, may lead to enabling toxic behavior or misdirecting therapeutic interventions. This is especially critical in family law, custody cases, and domestic abuse situations where a clinical label can be weaponized or dismissed. That's why ethical, careful diagnosis matters. Part 8, Can diagnosis lead to healing? ***. The short answer is, yes, sometimes. A diagnosis can be a turning point, especially if the person is in a place of crisis or openness. With long-term psychotherapy, particularly psychodynamic therapy, schema therapy, or mentalization-based therapy, some individuals with NPD can improve emotional regulation, develop more authentic relationships, learn to tolerate vulnerability, build empathy incrementally. Healing is not about curing narcissism, but about reducing its harmful impact and building more integrated ways of being. That requires time and commitment and courage. Final reflections, Mirror Mind ***. Diagnosing NPD isn't about labeling people. It's about understanding them deeply, carefully, and compassionately. It requires clinicians to move past assumptions, listen beyond surface traits, and hold both accountability and empathy at the same time. So the next time you find yourself asking, is that person a narcissist? Take a moment. Ask instead, what patterns are emerging? What's the emotional cost? And what might be going on beneath the surface? Understanding NPD doesn't just help us deal with others. It helps us understand ourselves, our needs, our wounds, our boundaries. Thank you for being here with me today. If this episode helped shed light on something you've been wondering about, consider subscribing to Mirror Mind and sharing this video with someone who might need it. Until next time, stay open, stay kind, and as always, keep reflecting.